Hey guys, my name's Alana. Welcome back to my YouTube channel, That Grunge Girl. If you're new here, I post mental health videos every week. I have playlists with different mental health topics that you can check out depending on what area of mental health you're interested in. You should always consult with your GP first before making any decisions when it comes to medications and referrals and mental health treatment. For today's video, this is just going to be a short one explaining the medication Valium, which is a benzodiazepine. I'm going to be talking about benzodiazepines in general and the one that I'm on and how it's helped me, the side effects, and the positives and negatives. So if you're interested, keep on watching. So benzodiazepines are a class of drugs that are known as sedatives, and they are often prescribed for a few different reasons. They can be prescribed for people who are coming off alcohol withdrawal to try to manage the physical withdrawal symptoms. They can also be used in hospital and out of hospital for mental health in regards to psychiatric problems. They can also be used for pain medication, pain management for your body. So these medications are known to be addictive, which is why when you are given these medications, they will be the doctors or the psychiatrist or whoever is prescribing them will monitor you very closely to make sure that you are taking it in the right way. For some people, you never have an issue with it. Other people, unfortunately, have gotten addicted to it in the past, and it has turned out into a full-blown substance addiction problem. That isn't to scare you, that's just a known fact about these drugs that you need to know. These medications are very powerful medications and shouldn't ever be taken lightly. So for me, I take Valium. I take anywhere between 2 milligrams to 5 milligrams, and occasionally I'll take 10 milligrams. So I use Valium. There's a lot of different benzodiazepines. They kind of all end with the word Pam. So Valium is just the one that I take through. So this medication for me really helps me. It's actually called Diazepam, but Valium is known as kind of like the general name of it, like the brand name, but it's called Diazepam. I've been taking this one for a few months now, and I only take it as a PRN, which means I only take it when I need it. I do not take this medication every day. Some people do. I don't. I take this one when I have work, so I'll take that on top of my normal medications before I go for my shift at work. And I'll also take it if I'm at home and I'm having a panic attack, or if I'm out, I'm feeling extremely panicked and anxious, or if I have taken my medications, done my sleep routine, and I still cannot sleep, and my sleep is becoming a problem because I have bipolar and sleep is really important for me. So sometimes if I'm desperate and I cannot sleep, I might take an extra one. So an example of how this medication can work is that for me, I take it and then it gives, usually I wait about 20 minutes and I can start feeling the effects. Really all it does is just kind of calms your nervous system down and it calms your body. And for me, it has been mainly prescribed for anxiety because I do have panic attacks and agoraphobia and social anxiety. I recently just got a new job and I've only been working there for a week, so this medication has been added into the days that I'm working because it helps me manage my anxiety levels. And the other day I had work and I was really struggling with work because of my anxiety and my learning disorder, and I had taken my 5 milligrams in the morning with my medications that I already take normally, went to work, and then I had about 3 hours left of my shift and I was really struggling, probably 2 hours left actually, and I was about to have a panic attack in work. So I went to the bathroom, started having a panic attack, and I managed to pull myself together enough to go back to work and then go and take another 5 milligrams. So in total I took 10 milligrams, and that was enough to kind of stop the panic attack going on. And if I didn't take it, I was not going to be able to finish my shift. So those are the times when I use it. The other times that it can be used as well for me is if I'm manic. But usually we will use things like antipsychotics over benzodiazepines. Benzodiazepines are not a bad medication. I think they get a really bad rep. I think the thing is that you have to be responsible and you have to know yourself and you have to know, um, when you think you need to take it. So, I try everything else first. And then if that isn't working, apart from work, I always take it. But with everyday life, I try everything else, all my other tools. And if none of them work, then I take the medication. Also, I have my mum who monitors my medication, who has access to my medication. I cannot just freely go taking it. So, a good suggestion would be if you live with somebody else, like a partner or a friend or somebody, you may be able to get them to hold on to the medication and you can just have maybe one or two in your bag that you can have access to. But just to have that other person there to help you monitor what you're taking, when you've taken it, and how many you're taking could be a useful suggestion. For me personally, I've never had any problems with addiction, so I am at extremely low risk, and this medication I only take it, like I said, when I absolutely have to, and I really don't like taking it. I prefer to try to do other things first. So some side effects of this medication can be having trouble with your motor movements, because it can affect your movements. For me, it does make my movements a bit slower than normal, so it kind of slows down everything a bit, so my speech can get a little bit slurred. My vision might start to get just a little bit dizzy, or a little bit yeah, kind of a little bit dizzy. This is not like, once I've taken it, this starts to happen, but then it will go away. Like for the rest of the day, it won't be there constantly. Other negative side effects could be that like slurred speech. Sometimes I get motor movements could be affected. You might feel really tired because it does relax your body and sedate you. Um, Another thing that it can do is sometimes you can put on weight from it as well. It all depends on what level, like what milligram you're taking. Some different benzodiazepines are actually stronger than other ones. So one benzodiazepine, even though they all come under the same class of drugs, one can be known to be a lot stronger or sedating than another one. So for me, it doesn't really give me brain fog, although it does if I take if I take a higher dose because I need to, it does kind of give me a lot of dissociation and dissociative feelings, which then again can make it quite hard to keep up with conversations or interact. But I think for me, the positives again outweigh the negatives because it relaxes my body physically, because I have very bad anxiety that manifests very badly physically, so it relaxes my body. It gives me the ability to slow my thoughts down so that they're not racing and I can actually think to do my job. It helps with feeling confident and being able to socially interact and follow conversations, and be able to do the tasks that I'm being told to do and remember them. So for me, that is the benefit. It also comes down high levels of irritation, um, that I can experience with BPD or with anxiety. So that is for this video. I hope this helped you. If you're ever thinking about going on one of these medications, you always have to look at the pros and cons, do your own research, ask your doctor, ask your psychiatrist, listen to the people who know about this, and always get their advice. But yeah, if you're on any type of medication that is a benzodiazepine, comment down below and let me know which one you're on and if it helps you, because I know for some people it doesn't actually help them. So thank you so much for watching this video, and I will see you in next week's video. Bye!